Hey everyone, it's Michael here at Home Health Success Academy and 10xpatientreferrals.com. What you're going to be watching here is an excerpt coming from our webinar on how we actually taught a lot of our current members at 10xpatientreferrals.com how to be able to take advantage of the current COVID-19 epidemic and how to be able to double or even triple your referrals by taking advantage of the current state that's happening right now. So just to let you guys know, you're going to be watching an excerpt coming from that 2.5-hour webinar that we actually created. But at the very same time, if you enjoyed this quick excerpt, you're going to be able to actually watch the full webinar. All you have to do is click the link down below. And at the very same time as watch the webinar all the way through, because it's going to be on for a very limited time, then we just pull it out. But we're going to be offering you guys a lot of additional bonuses that you should take advantage of now. So enjoy the video and make sure you click the link down below after you watch this video. Okay, so now we're going to be moving forward to problem number 4 that a lot of agencies are facing right now at this very moment because of the COVID crisis that's going on, right? So the fourth problem is current patients are canceling services. And we're seeing this a lot right now, okay? So on the previous problem number 3, we talked about patient referrals are going down. Now we're talking about, your current patient census is dropping as well because a lot of people are canceling their services. And we're seeing this a lot because, remember, everybody's so fearful about this. The last thing they want is outside people coming in. So let's say, for example, you're a home health agency, a medical home health agency, and, you're bringing in nurses, you're bringing in therapists, you're bringing in social workers, you're bringing in home health aides, home visiting doctors to this patient. A lot of patients are really scared on what's going on. And so they're trying to prevent people from going to their house to bring in bad things. Just like, for example, nursing homes preventing people from coming into facilities, such as visitors, patient family members, or even at the very same time as, social workers or marketers like us, for example. Okay, so the fourth problem is current patients are canceling services. Or if it's not the patients, it's their loved ones or family members are canceling services because they are just trying to prevent from people to going into their household, okay? And that right there is really, 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 really understandable. You can understand what that's going on. And so what we need to do to control that is we need to be able to address things. And this is where education happens. Sometimes, a lot of people get bombarded by all this different information coming in from CNN, MSNBC, coming from Fox, all these different networks, YouTube as well. And the thing though is if we can actually give them an education, if we did this early on before everything started happening, we could have prevented the loss of potential current patients, okay, or the current clients that we're servicing. So your agency needs to do a really good job on providing education, providing information so that the people that you're caring for, especially their loved ones, are aware that it is more important that we are providing care. Because us coming into the patient's house, us providing services for them is what's going to be able to make them understand that they need us as a frontliner to be able to, first of all, pay attention to potential symptoms that are happening, providing care, because a lot of doctors, for example, are not allowing people to visit their offices no more. Okay, so that's the thing that we need to try to prevent. So number one, everyone's scared. And so the reason why people get scared because they're not educated. And if we can provide them education at the same time as provide them step-by-step things that can prevent certain things from happening, allows us to be able to, number one, provide great care for them, and at the same time as lessen the chances that they actually cancel our services. So what are you guys doing right now to educate people? Right? What are you doing right now to educate the family? And so this is where your team in the office, this is where your nurses, your caregivers need to provide some great information. So other than providing, information towards your potential referral sources, you need to also make sure you take care of your base, your current patients, your current family members that you're servicing as well. Because we don't just serve the patient, we serve the family as well, the people that live in the house as well. So this is where we provide care packages for the patients, masks. We provide antibacterial soap, antibacterial, the hand sanitizers, right? You need to be able to make sure that these are being provided as well as giving them instructions, okay? So we actually did a study and we actually asked, all of our patients that we're servicing and as well as family members. And we found out that typically the average person only washes their hands in average about 0.75% at home. okay? That's what we were seeing. This is, of course, not including the fact that they took a bath, right? And so this is where, talking about hand washing is such an important thing. And the worst part about it is that there's all these educations about, hand washing that they actually don't, they tell you how long you should wash your hands, but they don't specifically teach the people how they should pay attention on washing their hands. What are the different procedures that they need to do? And so this is where we take it to the next step of providing education, providing videos. So our nurses, for example, our caregivers, other than the fact that they teach the patients, they tell them what they need to do, by providing them with videos on how to do it correctly, they can actually show this to the patient. And then at the very same time, part of the education is return demonstration. Can they return demonstrate that they know, and they can actually follow through with the knowledge that you're actually providing? Now, one thing that we actually did was this, is that earlier on today, I explained to you guys about our medication reminder program, where we use a company called medicationreminderprogram.com, and they call the patients every day to remind them to take their medications twice a day. They call them at 9 o'clock in the morning, exactly 9 o'clock in the morning, exactly 5 p.m. every day. And the cost is less than $12 per patient for the whole month. It's worth that. But we actually talk to them and say, hey, can we do something about about additional reminders? So the company, what they're doing now is they change the call, and then within the call, it reminds the patient to wash their hands. So other than taking your medication, reminding them to take your medication, we're also reminding the patients at least twice a day to go ahead and make sure that they wash their hands. Because the number one prevention on the whole COVID spread is to actually wash your hands and to prevent your hands from touching your face, because we want to prevent any transfer of the virus if it is present in the patient's home. And that right there is an important. Fear normally happens when people are either not ready for something or don't have enough information. And if we can actually give them the information, it prevents them from actually reacting late or panicking from something that they are not fully aware of, right? So we want to be able to make sure that they're not canceling their services. Providing educational materials. We actually make sure that we do live calls coming from the office. Check